I certainly do. I had a client that had fusion of his cervical spine, and when they were doing the operation, they actually found cancer in his throat. And he also had radiation and chemotherapy to obviously get rid of the cancer in his throat. But he had a lot of issues afterwards, especially when it came to swallowing. Okay. He had a very, very dry mouth, and he sometimes would regurgitate the food that he was trying to swallow, and it would come out not only his mouth, but his nose as well. So he was only having clear fluids. He was scared to swallow. It was sore to swallow, and it was very dry and tight. So he was living off just water and sustagen, and he was losing a lot of weight.
Hmm.
And I said, when he came in to see me, I was like, you gotta get off the sustagen. You need something more than that. You need to have some sort of bone broth soups,
Hmm.
and then later on progress to maybe mashed up foods, soft foods. And he was scared to swallow, not only because he was in pain when he was swallowing, he was scared that he was going to choke. And so I started doing my treatments on him. And again, I went straight to the palm. I looked at one side to the other and chose the one that had um, good color. One side didn't have good color. And the side that didn't have good color was the left side. And the operation we had where the cancer was on the left side too. So strangely enough, it matched up there already before I even did any of the palpation system. Then I went to her view on both sides and pressed into her view area. And again, left side was predominant. So I stuck to the left side. I went to the cervical area on the elbow. It tested positive. It was sensitive. Then we went to the thoracic area, and that was a little bit sensitive as well. In the lumbar area, no, there was nothing. So already, I was going to be going for the A point on the top of the head, which has got to do with the neck, the head area on that left-hand side. So what I got him to do was actually just swallow and drink a little bit of water to see how it felt before I put the needle in. So when I touched that area in the elbow crease where it's got to do with the neck, it was
Hmm.
sensitive. Then I went to the head, did the A point, went back and touched the A point. Less sensitive. Great, fantastic. Then I went to the bicep. He was obviously anxious as well to swallow, so he was nervous and stressed out. So I went to the brain points and I saw that the basal ganglion area was really sensitive compared to the cerebellum and the cerebrum. So I did the basal ganglion point at the top of the head. And at that stage, I was pretty new at Yamamoto Scalp Acupuncture. I just finished the course in 2023, and he had throat cancer, and it was quite tender right through the whole area. And it was really hard to distinguish where his sternocleidomastoid muscle was. And so I left the neck out at this stage.
Hmm.
And I palpated, found the A point, put the needle in. I did the basal ganglia, palpated, put the basal ganglia point in. And then I said, okay, I'm going to just have a look at these cranial nerves. So all I did was palpate through,
Hmm.
and between cranial nerve 9 to 12, I found some sensitive points. And if you look between cranial 9 to 12, you're going to see it's got a lot to do with the vagal nerve and a lot of things to do with the throat. Anyway, so I put those in. And then I went back and I said, okay, have a drink of water. And he had a drink of water. And he goes, oh, still a little bit sore, but you know what? Not nearly as bad. And he was able to swallow and take it down and not regurgitate the water, which is fantastic. And he noticed the difference, and I was really happy with that. Now, what's really good about Yamamoto scalp acupuncture here is that we're able to check our points are correct, okay, by feeling at the elbow crease, the cervical area, and then putting that needle in and going back there and touching it, it's telling us we got it. Okay. We don't even have to really check for the swallow, but it reassures our clients to tell them that, hey, you know what? We just did the right thing because the swallowing was better. He also said the dryness in his throat wasn't as bad. I said, well, is that because you've just been drinking water? And he goes, no, even if I do drink some water and take it down, it still feels really dry. And he didn't feel that the same type of dryness in his throat, which is fantastic. I've seen this gentleman 34 times. Okay. 34 times. And, you know, he's had surgeries afterwards where they've expanded his esophagus, you know, increased the diameter slightly and stretched it out. And as soon as that is done, he comes into the clinic and I do a short course of treatment for him to reduce that inflammatory response through his throat so he can start swallowing better, a lot quicker again. So he's moved from liquids to soft foods. It's a process. He notices the difference, which is fantastic. And I know when I'm palpating and doing what I need to do with Yamamoto, it gives me the confidence knowing where I'm pressing and then going and putting the needle in and coming back. And I press into that point. It reassures me as a practitioner I'm doing the right thing by my client. And this is something that the other styles of scalp acupuncture do not provide. And that's why a lot of you guys that are watching this podcast or on Zoom should be doing the Sustained Health Academy's YNSA course that's coming up in May.
Thank you.